we have a couple of things going on at Thrive that I think are really important for the same group. So I just wanted to make sure that you are aware of them and hopefully can take advantage of some of them. So we're going to be doing a strategic planning cohort for small organizations. And I know many of you have organizations that are under 2 million. And this is a free set of sessions. And if anybody's interested, we're going to have an information session on August 2nd to learn more about it. You can also learn more about it on our website, but I think that's something that some of you might want to take advantage of. Next, continuing with voter outreach. We are going to be doing a toolkit again. So you can get, your organization can get a stipend of $1,500 and a really cool kit that has everything you need to do voter outreach. So we make it super easy for you and you can do whatever you want with the stipend. And we hope you will help us with that. We still have low voter turnout among the same populations that you all serve. So young people, Asian Americans, Latinos, Pacific Islanders. So we'd love to get those numbers higher. And we're going to continue, of course, with the Thrive Wellness Wednesdays, which is open to anybody on your staff. And we appreciate the office of the county office for providing that. And Kirsten leads those as well. In addition, we have two things that I want to make sure that everyone's aware of. So on July 30th, there's Disaster Preparedness Day at the San Mateo County Convention Center that's being hosted by Carol Groom's office. We will be there. We hope some of you can come by as well. We're going to be talking a lot about the community organizations active in disaster, which is Thrive's new project to help coordinate the nonprofits as they respond to disaster with the county and with each other. And we're still in the beginning stages of that. And if anybody's interested in finding out more, let me know. But what's really important is a lot of what we're doing now has kind of laid the groundwork for this, right? It's you guys, it's the community organizations that are going to be part of this because you are the ones already who are responding in disaster. So the idea is to get more organized about how we do that. And the second thing that I think is also very relevant for all of us is the Climate Summit for San Mateo County. This is going to be on October 3rd. It's co-hosted by Thrive, along with Climate Resilient Communities, Nuestra Casa, and Rise South City. And the focus is really on the frontline communities, how climate is going to be affecting all of us. So again, it's this whole disaster preparedness and how we work together to prepare better. So we hope you can join for that. And with that, I'm going to stop with the Thrive commercials, but we do hope you join for many of those events. And I will send it over to Amelia next.
Hi, in case some of you haven't met me, I'm Amelia. I've been taking over for Helen. It's nice to see some familiar names, but just some quick updates from OCA. So we recently just distributed some of our test kits. It was nice meeting some of you there. Thanks so much for coming by, pick those up. And per usual, if there's, once we get more information about the next test kit distribution, we'll be sending out that request link. So you'll have test kits. And I think that's kind of it for me, but let me know if you need anything else.
So I think we're starting with an update from Dr. Chan. Thank you, Dr. Chan, for being here.
Thank you, Petra, and nice to meet you, Amelia. And thank everybody for all your work. I'm glad that you have these commercials, as you said, Petra, because the risk of COVID is going to persist, and we've done a lot already for our communities, but it's not just what we do, but how we do things and how we could do things together is really going to be the ways that we can reduce inequities, health inequities and social inequities in San Mateo County. And these are the same pathways. It's great to have a nonprofit like Thrive that can reach so many parts of our county. And it's so wonderful to have the expertise countywide of Office of Community Affairs to be working with agencies like health to address health inequities. And so it's not just COVID, and a lot of my brain has been invaded by monkeypox issues recently. And we need to apply the same principles and ways of communicating, coordinating for things like attacks on racial inequities, reproductive justice. There's risk of wildfires, extreme heat, and the list goes on and on. Just even in the last few days, just addressing spikes in substance use and overdoses, as well as things like suicide. So I think in all those different areas, there's an opportunity for healthcare, public health, local government, and CBOs to be working together. Very few counties or states have optimal ways of actually all working together. So there's lots of room for improvement. We won't be perfect, but we can be a lot better. So so again, just really appreciate you all for coming together. I know everybody's super busy and it's summertime. So with those intro comments, and hopefully we'll get a chance. So I'm going to share my screen. And I think Alberto really has a lot of the good messages and key info that you're looking for, but I appreciate you allowing me to just, so one, for example, way of like getting better. So I'm going to show some PowerPoint slides as well too, or maybe I'll show some PowerPoint slides. So are you all seeing like a Word document? So I think Tanya was saying, Tanya Perez, our senior community health planner for health equity, was saying that I think that some of our community members and promotores would want a one-pager about like a recent update. So this is a version of a one-pager that we'll disseminate. And we're going to take some of your comments, and Tanya and I will, and maybe Deandra too, and Alberto will huddle just to make sure the information, we can add additional information, but this is what it's going to look like. These are the major concepts, the updates in virology with BA5. What does community transmission look like? What are the new updates in the vaccine that Alberto will provide us? And how do we apply this like prevention message of limit that we've developed earlier this year for this time right now? So that's what we're going to send out. And if there's all these blue areas are actual web links that you can have. And previously, I think OCA and health has been sharing these key info, and we'll send out this key info as well too down here. So and I think that's like an example of like how can like government provide all the promotores and CBOs like some concise information. So I appreciate your guidance. So just to build upon previous presentations, am I showing the PowerPoint presentation now?
Yes.
Yes, okay, super. So I think at the previous OCA meetings, as well as the county managers VCWG meetings, I think I've been showing updated versions of this. So I just want to say, we're building upon this now, right? Like, okay, we went through all these, like in the winter, we went through BA1, then we talked about BA2, and now we're at BA4 and BA5. All these are just variants of the same Omicron. It's just increasingly more and more transmissible. It makes sense. That's the virus that's going to be more and more transmissible, is more infectious, is going to have an advantage over other viruses. So it's going to crowd out other viruses, evolutionary advantage. So, and this is where that graph is. I think I spoke to CCAT in May, VCWG in June. We talked about BA5 at that time, and now BA5 is like 2/3 of the cases, and probably by next week it'll be 80% of the cases. And previously we showed this in June, cases was going up, but at that time we emphasized this is the reported number of cases, but the actual number of cases is much higher. We showed you this at that time. We showed you, hey, look, wastewater surveillance, it looks like it's about as high as it was in the winter time in San Mateo County. And when you look at our other wastewater surveillance sites, other sewer systems, you could see these peaks in the western part of San Francisco. And, like this isn't there's a lot of variability in the testing. You could see that this peak In the western part of San Francisco and Palo Alto, this peak is just as high, if not higher, than any other previous peaks that we've had. This is the concentration of COVID in wastewater. It's higher than it was last winter and the previous winter when we had all those deaths. The intensity is higher, and the main thing is too, it's a lot longer too. Like previously we reached a peak for like 4 or 5 days and it went down, but now you're having the sustained community transmission of the virus. And this is a very complicated slide that I'm probably not going to send out publicly, but just for you all too, because this is from the state and we're not supposed to disseminate this. It's not official yet, but this is so the number of reported cases here, this is where we are right now since basically April, and we've been high since May. But this is reported cases of PCR tests and some antigen tests. But like I showed you, the actual number of cases is way up here, right? That we could take from the poop surveillance, the wastewater surveillance is way up here. But what we know now is that deaths, there are deaths definitely happening. I read all the death reports of each individual, and people are being hospitalized, but it's not to the same level as we had this past winter and the previous winter. So again, people are definitely getting infected, probably getting some long COVID, at least two, some people are getting runny nose and coughs. Some people have coughs for weeks on end. Some people have long COVID. So it's not the overall broad public health emergency that we had previously. So, that's the reasoning behind we probably won't have local health officer orders that in which one individual has the power to mandate that everybody stays at home or everybody has to wear a mask wherever they go indoors. That legally probably exceeds the public health officer authority, but there's ways in which we can still protect ourselves, and agencies and organizations can protect themselves. So this is that one pager that I just mentioned. I think hopefully all those comments, I think these are all the bullet points here, key points here. The headline is that variant infectious BA.5 has become the predominant strain in the Bay Area. It spreads more easily than earlier variants. Thanks to you all and the great questions that you have. It's just that this is some language you could take and some confusion. So recent vaccination does reduce the likelihood of severe disease. So vaccination still works. However, vaccinated individuals can still get infected, like Biden just got infected, experience at least mild to moderate symptoms, and transmit the virus to other people. So the vaccine still works, but don't think it's like perfect. It's not going to prevent all infections. For us locally, there's very, very high levels of SARS-CoV-2 circulating in San Mateo County, and it's been increasing steadily since actually April, but it's been really high since May. And just want to this is that graph that's actually publicly available. This is the daily cases, and this daily cases really here is of reported cases is it's an artifact that it's low because it's reported cases really up here. But we're not seeing the number of deaths as we have been in the wintertime. So, and the modeling of this is that it's going to increase through mid-August, then staying high for weeks. And I think the local factor for us to understand is that in San Mateo County, most schools reopen on the week of before August 20th or so. So this may impact community transmission levels at schools. Alberto's going to talk a lot more about vaccines, but something I want to highlight and a link that I put for you is that the MMWR is going to officially release either today or tomorrow, but they had an early release. And the key point is that the effectiveness of the vaccine increases with the third dose. So everybody, it's also called the booster. That's one concept. The more, that's just like a lot of childhood vaccines require 3 doses or 4 doses, right? And also that's one concept. And the second concept is waning immunity, that the antibodies start decreasing after 3 or 4 months. That's why the guidance is to get a booster within 4 to 5 months. So within 6 months, everybody should get a booster, right? So that's like a general concept. There's some nuances for that. So, I think you've seen our county start emphasizing, I think even though children were eligible, which is important and safe, the vaccine is safe and effective, and I recommend that all children over the age of 6 months get the vaccine. This really is important time to emphasize, and there's no question now that all older adults over 50 years old should get a booster. I mean, I think, like, for example, in the Chronicle in March or something like that, I kind of like was weighing, like at that time, the rates were kind of going down. I think I said something like, I didn't make the appointments for my parents yet, but it's now, I mean, my parents have been vaccinated now. It's really important to make sure that your communities know the risk is high right now. Their immunity has dropped, and now is a good time. Now is a very good time to get a booster. There might be an additional vaccine in the fall, maybe October, November, or December, that includes like the BA.5, but then you can get a booster at that time. So I think particularly for those people who are over 65, over 50 years old, are all eligible, and really emphasize it. This is a good time. You all have seen the limit before. I think you helped develop this, so I think just to apply that, limiting large gatherings to well-ventilated areas or outdoors for July or August, and August makes a lot of sense. We're going to start, we've been emphasizing through the press, and we'll probably develop a clearer local document for this point, just to clarify the language from the state guidance is this right here on the right side. So we're going to say something like this, and we welcome your comments if we should change something, or do you think this is the right approach or not. To prevent infections, businesses and organizations should consider requiring all patrons to wear a mask and asking all patrons to wear a mask. And the considerations depend upon, how good the indoor air quality is for that building, and the ventilation, the number of individuals that you serve. Is it one or two, or is it going to be crowded? And the community that you're serving. So those are my comments. I'll be staying through 11 o'clock to see if there's additional questions and comments and suggestions. So thank you.
Dr. Chan, can I just ask you, I know this is totally not a fair question, but can you just give us a 1 minute on monkeypox in case we get asked?
Yeah, I'm going to try not to share a screen. You can. What are your general questions about monkeypox? It's just like a narrow the one, or should we do that afterwards? Let's look at.
Let's do it at the end, maybe. Yeah. Okay.
Or I mean, not afterwards, but towards the end. So because I think Alberto's comments are going to be really helpful, and we met last evening to be coordinated. So this is an opportunity for us to be coordinated.
I see Henrietta has her hand raised. Henrietta, if you want to unmute yourself.
Yes, thank you so much. Dr. Chan, you mentioned that, or at least explained how the BA.5 variant is the one that's the predominant variant, which means the other variants are still in existence and circulating. One, is this true, all of them? And number two, is it possible for someone to contract more than one variant at the same time, if not simultaneously?
Yeah, that's a great question. Yeah, so it is possible, and it probably happens all the time. My daughter's actually watching a movie right now at a movie theater, which is very rare. But yeah, so in that crowded movie theater, so she's wearing this morning I reminded her that she should, or last night I reminded her that she should be wearing an N95 mask. So yeah, so in a crowded movie theater, maybe 10% of the theater, of those who are maybe in nobody's going to watch an early matinee like this. But if there was an evening show, let's say there's 200 people, there's probably 200 people, probably 20, 10 to 20 people are actually infectious. And if it's a funny movie, they're going to be laughing, and the virus will be in the air. And maybe of those 20, 16 people are going to have BA5. And I'm explaining this all out so because some of the concepts aren't here. So in my mind, this is how it works. So it's like, okay, 16 out of the 20 will have BA5, and 4 would have an earlier version, BA 0.2, 0.12. So, and that's going to affect it all at the same time. But they're all actually subvariants. They're all very similar right now. So, but the virus, but then her immune system, she's been boosted once, so then is going to attack them really the same way. So great question. So I think it becomes more relevant too when there's another strain and there's worldwide surveillance of different strains that's coming. Let's say there's a different, instead of Omicron, there's Zeta or something like that. When that comes in, it's not different. It's like, just like Delta made a big jump to Omicron, and there's a new strain that causes more severe disease. That's when we're going to be like in big problems. If there's a Zeta that causes more severe disease, and the case hospitalization rates or case fatality rates are higher, that's when we're going to implement a new health officer order.
It seems to me, having all of these variants circulating, and the fact that we might be inoculated against 1 or 2 of them, but still be able to catch them, it's kind of scary.
Yeah. No, thank you for your question. I'll try to answer it more concisely and try to conceptualize your questions to other communications we have. So thanks, Henrietta.
Thank you.
Sandy, feel free to unmute.
Thank you. It's good to see everybody. My question is about something that you had on the previous slide where there were 2 statements about masking. So one is that your wording is going to be that we would require masking by patrons, and the other one is that we would ask them to mask. So that feels to me like 2 different locus of controls. One is if we're requiring it, that is something that we're doing as a service provider. The other one is if we're asking them to do it, then it's up to them to decide whether or not. So those feel like different sides of the same coin and not the same thing.
Absolutely.
Which is your preference, or do you have county guidance that we should be following?
Yeah, I think that's perfect, Sandy, and I think senior co-signers is a great example for that. So that's all going to be extracted from the California Department of Public Health mask guidance, like in which it says basically, based upon the epidemiology at the time, businesses and organizations and venue operators should do these 4 things. It includes like informing people, like allowing people to wear masks, providing masks, and then there's a part that says requiring people to wear masks. So it's basically the quotes you see there is from that, and so it will be a longer document with longer guidance about that. So basically, for an organization like yours, I mean, we're going to be basically saying, you guys should decide that there's not going to be a local health officer order or requirement drafted by Dr. Morrow or myself that's going to require countywide. But we're going to say that just remind every organization you can implement your own requirement. Is that fair? And you should consider one or the other.
Right. So what we've found helpful in the past is always to have a clear guideline, because then if anybody asks us, what is our policy, we just say, we are following this current guideline. So if that guideline says that, all organizations that serve people who are 65 and older in those organizations, it's required that a mask is worn, then we just point to that guidelines. If it's, you know, well, you could do this or you don't need to do it, then people are like, well, I'm going to do what I want. You know, it makes it more difficult for us to have our policy if we don't receive a clear policy.
Yeah. I understood. I agree with you. I think there isn't enough, there isn't, because like, we're not as a one county, we're not able to do, I mean, we're in a, it's not a vacuum of like other counties and the state and the feds. Because there isn't a mandate, and the feds and the state aren't nimble enough to adjust to every situation. So I agree they would be good. So we can, if a group of, let's say, older adult agencies wants to, organizations want to get together to have like, what are we doing as a community in San Mateo County? I'd be happy to join that committee and help you decide which one. I think the county health officer in any of our counties throughout California and the state are reluctant right now to just issue something of like all older adult agencies should issue a mask requirement. It's very sporadic right now. It's like, I mean, I think that's one area. For example, the biggest hot button is like schools. You just saw that San Diego is now requiring, school districts, all their school districts will have a mask requirement. San Mateo Union did so as well too. So I hear you. I think what we're going to do is put together a one-pager to provide some guidelines. If you don't mind, I could send you a draft so you can take a look at it and provide some advice. And I don't mind doing it because it doesn't take me that long just to type it all up. But like the process and the questions and the legal challenges that come afterward is too overwhelming for us to to be able to address, because it's not just older adult agencies. It's like, why not bowling? Like, why not like pools? I mean, it's just like infinite,
Okay, thank you. Everybody's in a hard position here, and we're all trying to do our best. So thank you for all that you're doing. We appreciate it.
Yeah, I do think we should do something. So Sandy, I think we should do something so it's not super confusing. So and I don't know if Christina Yugatafa is on this line too. Like, yeah, we could have like guidelines. So I don't mind putting guidelines. So I hear what you're saying, and maybe you've helped me talk it through. I appreciate your patience. And if we want guideline, and I really don't know what's helpful for, like, I don't want, I'm happy to help draft any one pager as well too.
Okay, thank you.
Thank you.
Casey, feel free to unmute.
Hi, thank you, Dr. Chan, for being here. Super interesting, and I appreciate how polarizing it is to come out and make some sort of a policy. So totally appreciate where you're at there. But I wanted to go back to the topic of the wastewater surveillance. Can you tell me a little bit more about that? Like what exactly is it, and how is it showing greater transmission?
Yeah. So so what what happens is that research labs, they're working with the state health department at Stanford and Berkeley, for example, and our lab is actually going to start just in the process of start doing it. Takes a sample of wastewater, and they utilize a bit kind of a similar method as they do. I mean, I've seen their methods. Sort of explain really briefly like what it is, and they test it in the lab based upon they have like this equation of like how much wastewater they're having, how much of it is from storm runoff, and they are able to standardize it to the amount of and then they run PCR tests to like what is the concentration of COVID in the wastewater, and they utilize it, but just like for PCR, the number of cycle times to see like kind of what is the constant. They're able to estimate the concentration of COVID in the wastewater. Some of the caveats I showed today, I think when you're just, there's Stanford has this Silicon Valley, San Mateo one, and it just gets the wastewater sheds of Belmont, San Carlos, Redwood City, Menlo Park, and I'm not too sure if East Palo Alto was in there. So the reason why I show other ones is because that's a really kind of a smallish portion of our county in general. So it doesn't really represent really the poop or the people of all parts of the county, right? That's different socioeconomic status there. So that's kind of why I'm taking the parts of like West San Francisco, which I'm extrapolating as like our North County, our North San Mateo County as a water district or wastewater district as well too. And there's the Palo Alto one, which might like. So when I'm seeing that, so that's why I'm taking them all as an aggregate. Like when you're looking, so it's not comparable across wastewater surveillance stations because their methodology is a little bit, the methodology is pretty similar, but the process, the way the wastewater system, the sewer system is different. But I'm comparing it within like itself. It's like a self-comparison in each part of the pandemic. And I'm basically explaining to people like I'm basically explaining to people, even though the case reporting, when people are following that, people are like, oh, there's not that much cases now compared to the winter or compared to previously. It's because people are not getting PCR tests. We don't have as many PCR tests available. I'm trying to make the point that like, if you haven't noticed all your friends getting sick yet, it's because like the wastewater surveillance is high. The way that the arc of the curve is like that, it's not gonna just dip down really quickly. And we know this from following South Africa and the East Coast too. It's not gonna come really quickly down. It's going to stay through August. And I think I'm explaining this because I'm trying to get like our communities ready when communities go back to school. There's probably going to be more community transmission and transmission in schools as well too. Does that answer your question? And feel free to.
Actually, yeah, that's really helpful. I'm just trying to wrap my head around how to talk about that with our participants. Just when we're talking about, that the cases might be down. And part of that too is so many people are getting home tested, right? And they're just self-selecting to stay home. But the wastewater surveillance, I just wanted to understand that a little bit more so I could just say that it is an indication that transmission is much higher. So I just wanted to understand it for myself. So thank you very much.
Yeah, thank you, Casey. And as you explain it, if you want to send some blurbs to me of how you're explaining it is effective, please let me know. It's funny because actually I talked this through with our executive leadership yesterday, and Dr. Morrill said, like, Curtis, you're not going to be able to explain like the wastewater surveillance. And he's like, oh my gosh, he was totally right, because you asked those great questions. So thank you. And I look forward to your advice as well too. Thanks, Casey. Okay, so I know Alberto, is there any more? I know Alberto, and I'll be on until 11 as well too. So I know Alberto has some good things to share too.
I think, excuse me, I think Henrietta has one more question.
Yes, thanks so much, Kirsten. Dr. Chan, since we can carry more than one variant of COVID, I'm wondering, and since I guess the body develops antibodies when we're boosted, vaccinated and boosted against particular variants, is it possible that having multiple variants in our system, if we catch them, could play a role in long COVID? For example, we're boosted against one variant, but not the other variant. And we have long-standing issues with COVID. Could it be the variant we're not boosted against and our body is still fighting it?
Yeah, you're amazing, Henrietta. I think in there I have like an MMWR paper in like that one pager. And you're right. So and it's not so much of the vaccine, but yeah, the difference. So there's you have many, you're saying many things in there, all of them valuable, all of them are being under researched right now, actually. So but I think the crux of your question is it's like, yes, you're right, like this combination of, actually it's more though like what you're infected by is what you're infected by, and the combination of like the vaccine, there is, the body is trying to understand that in different ways. And I think it's not at exactly at an individual level, but there are some patterns for that. I think it's really scientifically interesting, and 40% of it I probably don't even understand, when I just recently read those articles. But I don't think it changes too much precisely. I mean, it does change, but I'm not saying it's not too much of what we need to do right now. And like the big overall concepts is that we should get people vaccinated. And it's like, yeah. Do you have follow up to that, Henrietta? Like that?
No, no.
Yeah, I need another cup of coffee, and then we could chat while I'm having coffee. I need 3 cups of coffee to be able to go through all those good questions, and we could review some of the literature as well too, Henrietta.
Thank you.
All right, I'd like to pass it over to our other health team members on this call. I think, Alberto, if you had some slides to share.
Hi, good morning. I don't have any slides to share, but I will be going over what the COVID-19 response unit is currently doing, and kind of like where we're going moving forward into the year. So just to reiterate, our goal is always to reduce illness and death in San Mateo County. For the COVID-19 response unit, our priority targets are older adults. We're seeing that there is still a low vaccination rate for that second booster that we were talking about. So the next target would be the geographic target, mainly the coast for farm workers, and then race and ethnicity, and then school-based vaccination events. We're hoping to create work groups with our CBO partners and community in order to really hone in on these targets and be able to provide further education, outreach, and then at the end, hopefully hold a vaccination event to encourage those that we've outreached to get the vaccination. Currently, we do have 8 standing clinics throughout the county. And as of next month, we haven't put out the new flyer, but I can definitely show what we currently do have here. Let me just share my screen. So we do have 8 standing clinics, as I mentioned. In the month of August, we're looking to have those clinics scale down a bit to biweekly cadences, with the exception of the Fair Oaks Health Center. So we'll still be operating the standing clinics just on a biweekly basis. I also want to encourage CBOs, community leaders, etc., faith-based organizations to really utilize the online form that we have for vaccination pop-up events. So if your organization is interested in participating or hosting a vaccination event at your site, this is the form, and I can, if you don't have that, I can definitely resend that out to our partners in that partner list that I'm hoping that you're all getting. that's it for my vaccination updates. In terms of vaccines for under 5, again, we're suggesting that families that are seeking to vaccinate their children who are under 5 contact their pediatric provider and schedule an appointment. San Mateo County will not be offering large-scale vaccine clinics to the under 5 or its community standing clinics, but instead offering small-scale clinics at early Head Start, such as Izzy or other locations. But we are supporting some of our pediatric providers that serve publicly insured families. Other options for vaccines for under 5 are through the pharmacies, right? Through our local pharmacies such as Walgreens, which is indicating that they will vaccinate children ages 3 and up, and CVS for 18 months and older. Again, these anyone can find these locations directly on these third-party websites, or they can go through myturn.cea.org. We do have 3 to 11 PD clinics being offered in Mid-County and in the South County, specifically at the San Mateo Medical Center on Saturdays, and also at the Fair Oaks Health Center on Sundays. Let me just pull up those 2 flyers so that you can all see. So here's the San Mateo Medical Center. This is going to be at the west parking lots. The next one is on August 6th. We just recently had last weekend's our first start, and we didn't have such a big lots of traffic go through these initial clinics. So we're asking everyone, if possible, to promote these to our basically are aimed at our Medi-Cal clients. As the flyer indicates, this clinic is intended for San Mateo County Health clients only, and is not open to the public. So we really want to hone in on our underserved, vulnerable populations, and those typically tend to be those who have Medi-Cal, right? So we want to be able to, we've shared this information with BHRS, San Mateo Medical Center and the clinics, HPSM, here at Family Health Services, that includes the Health Coverage Unit, and WIC. WIC will continue, they did last week, and they will continue moving forward to make text message blasts to the families that they serve to indicate that these clinics are, there to serve their families, and they're able to answer or ask questions via the text message back. But again, they're encouraged to participate. These are walk-ins, so there's no appointments available. It's just first come, first serve. And again, we want to promote this to our San Mateo County Health patients for the 3 to 11. We're also exploring, and I think we're going to move forward with including 12 and over families for these Saturday events, just to make sure that we're capturing any and all families that are currently vaccinated, that are 12 and over, to get the vaccine as well, and not having to wait, for another event for them. So want to capture the whole family as possible. So that's coming up in 3 weeks. And again, it's at San Mateo Medical Center and at the Fair Oaks Clinic. So Saturday and Sunday, and then we wait for 3 weeks, and then we have the next event after that. So it stems all the way to September. So that's for the vaccines. Testings, just again, updating you all that we currently do have 10 test sites in 8 cities in San Mateo County. This is our flyer. Hopefully you all have seen it before through my emails that I've sent to partners. And if you haven't, or if you've never seen these flyers, please let me know, and I'll add you to my distribution list. Again, they offer rapid antigen and PCR testing. LHI, Optimus Serve, BAPE, PLS, and Curative are the ones that are operating in San Mateo County. LHI is the one that is contracted by the state, and they're mostly located in the north and mid county. These sites are test to treat. So again, there's a flyer floating around through that distribution list that I've sent out about what it means to be a test to treat site, as well as on the testing sites that the county has. Let me see, excuse me. And just to give you a little bit of what we're doing with OCA is we continue to partner with our colleagues at OCA so that CBOs are able to pick up over-the-counter test kits and distribute out to their community. So since March, this pathway, since March to now, there's been about 62,000 test kits that have been distributed out to CBOs and to the community. So this has been very successful. I just want to thank our partners there at OCA and our CBOs who participate in this pathway. Thank you, and please continue to go through this pathway as it's serving our most needed community here in San Mateo County. That's the end of my updates and information that I have to share. If anyone has any questions, please let me know. Okay. Oh, I see a hand raised.
Hi. I had a question about the test to treat sites. Generally, when you go, are they supposed to then talk to you about the treat part? Because when I went to a test and treat and they mentioned nothing about the treatment.
Right. Dr.
And I was positive,
right.
but
all right. Oh, you weren't positive?
I was, yes.
Oh, you were, okay.
But they don't know that until they get the results back that I already had symptoms. And I was just curious. I didn't necessarily need the treatment, but I was just curious as to if they're actually supposed to mention it at least.
Yeah, so my understanding, and Dr. Chen, you can jump in if you have more information, but my understanding as it works at the test to treat is that they use the antigen tests, and within the allowable time, they'll come back, and if it does come out positive, they should have already evaluated or registered you, right? And once they see a positive, they'll go ahead and I believe they have a checklist. And if you are in that category that qualifies for for instance, the Paxlovid, they'll go ahead and refer you and start that process of doing the telehealth connection with the doctor and prescribe and getting that prescription in motion. My understanding is that it's been taking about somewhere close to an hour to get that prescription back from the telehealth doctor. And then that's when, you would get that prescription filled and get the medication at that site. That's my understanding of that. I'm not sure if they're mandated or they would tell you that about the test to treat or the treatment itself at these sites if you're not eligible to receive it.
Okay. And I do know that I had a friend who had the blood transfusion because it conflicted with one of her medications.
Right.
That was a different situation, it was great that the doctor consultation, worked in that case. So maybe I just didn't qualify under the questionnaire. I was just curious just how that process worked so that we could talk to other people. And usually you do send the vaccination information in multiple languages. On the link that is set here, is the 3 to 11 in Spanish as well.
Uh,
that flyer?
Yes, I do have that flyer. So I just want to caution, I can definitely share this flyer and the link that is online. Is just making sure that this references for the 3 to 11 go to our San Mateo County Health patients.
Where
Again, it's not, yeah.
I wanted to post it where we do our CalFresh EBT clients.
Absolutely.
And
Absolutely.
we have a lot of Hispanics, so I just wanted to make sure I had a copy of that in Spanish that we could give them.
Yeah.
Perfect.
Absolutely. I can definitely share that. Yeah.
Thank you.
Mm-hmm. All right. No more questions? All right. Thank you very much.
Amelia, Megan, or anyone else on our call, was there anything else that you wanted to add in terms of updates or anything else? Otherwise, I would love to just take the last few minutes to leave it open if there are any other questions for our health team.
Yeah, no, I think that's pretty much it from us.
All right, if there are any other questions for Dr. Chan or anyone else on the call, feel free to unmute yourself or add that to the chat and I can vocalize for you.
Sorry, I just wanted to reiterate that all the test kits that we picked up last week, the expiration was extended because they do expire tomorrow. And just in case to let your clients know as they're picking them up, I've printed out, like made a special flyer to post right next to them where I give them out.
Awesome, thank you.
That's super helpful. Colleen, if you don't mind sending that to us or send, that would be great. And this example, do you know if the FDA extended is it 6 months?
On their actual thing, it says they extended the shelf life instead of shelf life by 6 to 9 months, but then in the actual dates, it's only 3 months.
That's interesting. Yeah, I was going to say, is it 6 months or is it 3 months? So it's like,
So I went by the actual, they have the listed expiration date and then the listed extended date that coincide. And I did those 2 dates instead of saying 6 to 9 months when it didn't add up.
Okay. Yeah. Yeah. If you want to send it to whoever, if you're either to OCA or me, and
sure,
you can take a look. And I mean, and that's where like this community can help each other, right? So we can have standard ways that we can inform folks about, the feds are just rapidly trying to work on stuff and communications falls through. And again, Alberto's answer was great, much more thorough and knowledgeable than I would know about the test to treat sites. Colleen, when did you go to the test to treat site? Or if you don't mind me asking.
June 7th is when I had, so June 7th, so that was Tuesday and I went on the Thursday, so the 9th at CSM.
So CSM was one of the first sites in California, actually. So yeah, as you know, like that these are contractors that we have contracts with, that Trish and Alberto's team contracts with, and they're trying to do, making sure that things are going smoothly. So it's helpful when we're getting feedback from the community of what's going well and what's not. And one point of confusion that we had was that not everybody's eligible because not everybody's at risk for moderate to severe disease if they don't have severe health conditions. But there were a lot of bumps in the road, and there continue to be. So when there are significant bumps, we just heard on Monday there was bumps on the road from one of the testing contractors that we don't contract with but are in our county, about them asking questions about like social security number. So we're looking into that too. So it's really helpful when we're able to hear what's happening on the ground. So thank you. I think there's a question about monkeypox too, so I can answer that. Oh yeah. Anything you wanted me to particularly know? I mean, what, Petra, do you want to say a couple of things of like what the concerns are?
I just want us to be able to answer if somebody says to us, when people are out in the community and talking about vaccines and stuff, and somebody says, what about monkeypox? What do we say? is it like, I guess the questions are kind of like, is it a danger? Does the vaccine work? Will there be vaccines for people? I don't know if people are getting those questions yet, but I figure pretty soon they will be.
Yeah. Okay, so for this community right now, that's really a general community in San Mateo County serving, I've had so good comments about sort of like older adults. And so monkeypox currently in California and the United States, over 95% of the cases, closer to 100% versus 95%. So first of all, monkeypox is spread not through in the same way as COVID. It's spread through primarily through close contact, particularly close contact with the actual pox virus. So it's not spread typically through respiratory droplets, and much of the rash typically right now is happening in the genital area. So there's close contacts. And this type of contact can occur through heterosexual or homosexual sexual activities. So the pox virus doesn't discriminate, and everybody could be infected theoretically from monkeypox. The outbreak that we're having in the United States and California currently is primarily affecting the MSM community, men who have sex with men community, particularly the community that's having multiple partners right now. So the risk that the communities that the Bay Area and California is focusing on is the MSM community. But not necessarily the entire MSM community, but the community that's having we know that places where the largest outbreaks have happened are sex in the community that's in public places with multiple partners. There's a large outbreak, for example, one of our largest outbreaks in the Bay Area is at the Berkeley Steamworks bathhouse. So that community is particularly at highest risk right now, and our communications and our outreach is focused on that community that's most currently at risk. Does that answer your questions? And
yeah, I think that's super helpful just to give us kind of an overview of like, we don't want people to panic.
Right.
So if we can say something like, it's very small and it's currently in a very small community, I think that's helpful. And to know that it's not spreadable in the same as easily as COVID is right now.
Yeah.
So thank you. We have -1 minute left, and we had how short can you make this?
I can make it very short. But I don't know if the answer might be short. Dr. Chan, why is it that diseases like AIDS and monkeypox seem to start with the MSM community?
I think most diseases, that's a long question, but I don't think that most diseases start with MSM community.
Not most, but disease, AIDS and monkeypox.
I don't know if monkeypox has, because it was started in other parts of the world. So yeah, I don't know if that's true, but just currently right now, what we know is for monkeypox, it's spreading in the MSM community. But as you've highlighted previously, and I would just say just generally, to Petra's comments, as you could tell from me trying to answer these questions, that's kind of like the confusion that monkeypox has had. We don't want to, the press has not been, and public health has not wanted to, oh God, my brain is not working in terms of vocabulary. We don't want to unfairly label a particular community. At the same time, when we don't do that, we're not very specific on who's being affected, then the rest of the general community is worried. So that's the balance that we have. So, but yeah, but our efforts right now are intensely on specific communities, but not the overall general community currently. Like I say, it's like, actually it's closer to 99% of the community that's affected are not just people who are gay or men who are gay, but actually men who have sex with multiple partners. And I think a risk category is, for example, men who have partners, twice, multiple partners in the last 2 weeks. But there's many diseases, many sexually transmitted diseases are transmitted through heterosexual ways too. So our major thing that we're worried about, and I have been focused on, is syphilis, for example. And so our major concern for syphilis is syphilis in pregnant women. So good questions. And again, these are like how I open this is like that the pathways for disease prevention, avoiding stigma. I mean, we try to avoid stigma early on in COVID as well too, and that intersects with mental health and stress. So like as we're working on each specific disease or a new intervention, whether it's Paxlovid or a new vaccine, it's not just the science, but how do we actually coordinate our efforts together? That's what we need to improve upon. So just really grateful for all you do to connect with the communities that you serve. So thank you.
Thank you so much, Dr. Chan. Thank you to our county health team and to everyone who joined us on this call. And we'll be in touch with more resources and information very soon. Thank you all. Have a good rest of your day.
Thank you.
Thank you.
Thank
Thank you.